nutrition specialist, MSc in health education, staff of NCDs اللي هي تابعة ل Communicable and Non-Communicable Directorate, Federal Ministry of Health. National stepwise survey, the goal is to provide baseline indicators on determinants of non-communicable diseases, NCDs, and their risk factors among Sudanese adults. Study design, the data collection followed the WHO stepwise survey manual, which recommends 3 steps. Step 1, behavioral activity, behavioral risk factors, tobacco use, alcohol consumption, diet, physical activity, history of raised blood pressure, history of diabetes, history of raised total cholesterol, history of cardiovascular diseases, lifestyle advice, cervical cancer screening, and oral health were also collected. Step 2, anthropometric and physical measurement, and step 3, biochemical measurements. The survey was conducted jointly by Federal Ministry of Health, WHO, and Central Bureau of Statistics. It covered 11 states from 6 geographical regions: North, East, Khartoum State, Central, Kordofan, and Darfur. Sample size was 8,154 household survey individuals from 302 clusters. Step 1, tobacco use. We ask the step 1, it's about questionnaire and collected by tablet. We ask about the use of tobacco, the overall use of tobacco, currently smoking, total in Sudan 6.9, and the maximum was in Eastern 13.1, and the lowest one in Darfur 7.7. Those who are currently smoke tobacco daily in Sudan 7.7. The maximum one in was 11.4 in Eastern, and the lowest one is in Darfur 5.8. Average started years smoking 19.3 in Sudan. The maximum use are in Central 20.3, and the lowest one is in Kordofan 18, Khartoum 18.1. Percentage of daily smokers smoking manufactured cigarette, it's in total in Sudan was 93.7%. The maximum was in Central 93, and the lowest one in Khartoum was 91.8%. Mean number of manufactured cigarettes smoked per daily by members of manufactured cigarette, the total was 8.4. The highest was in Eastern 9.2, and the lowest one in Khartoum was Kordofan was 7.5. Alcohol consumption, percentage who are lifetime abstainers, total 94.8 in total in Sudan, the highest one in Central 95.6, and the lowest in Kordofan 94.2. Percentage who are past 20 months using 2.5 in total in Sudan, and the highest in Eastern 6, and the lowest in Khartoum 1.3. Percentage who are currently drunk alcohol in past 3 days, total in Sudan 2.1, the highest in Eastern 2.3, and the lowest one in Central 0.8 percentage. Percentage who engage in heavy epidemic drinking 6 or more drinks on any occasion in the past 30 years. Overall in Sudan 1.9, the highest was in Eastern 2.3, and the lowest in Central was 0.6%. Physical activity percentage with insufficient physical activity defined as more than 150 minutes moderate in week. In total in Sudan 14.1, the highest in Central 15.7, and the lowest in Kordofan 8.1. Medium time spent in physical activity on average per day, minute 42 in Sudan. The highest was in Central 12.4, and the lowest in معليش الخط وشوية طيب. Percentage of engaging in vigorous activity in Sudan was 62%. طيب الدايت and main number of days fruit consumption in typical week 1.9, which is very low, and main number of serving of fruit consumed on average per day 0.5 in Sudan. Main number of days vegetable consumption typical week 4. Main number of serving of vegetables consumed on average day 1.2. Percentage who ate less than 5 serving of fruit or vegetables per day 94.7% in Sudan. Percentage who always or often add salt or saltish sauce to their food before eating or as they are eating 32.4 in Sudan. Percentage of who always often eat processed food high in salt 12.3% in Sudan. It varies from state to state, and also from urban to rural, and also from women to men. And also, so the soft report with me. If everyone has interest to, I can give him as in email. The risk factor of NCDs, which are diabetes, hypertension, raised alcohol. Percentage of women age 30 to 49 years who have ever had a screening test for cervical cancer 1.7 in Sudan, and it varies from state to state. Percentage who are overweight, and those are the BMI between 25 to 29, 18% in Sudan. Percentage who are obese 10.3, average waist circumference, and those who are raised blood sugar 6 in Sudan. The prevalence of diabetes in Sudan was 6%. Of those who are high blood pressure was 28.5. Conclusions: the result of the survey indicated that adults in Sudan have several risk factors for developing chronic diseases. Tobacco, the overall prevalence of smoking was 9.6, significantly higher prevalence among men 17.1 and women 0.7. Physical activity overall are 14.1 of Sudanese, 11.4 men and 17.3 women do not engage in the recommended amount of physical activity. Overweight and obesity, 28.3 of Sudanese adults are either overweight or women, 35.6 men, 22.6 males. Dietary pattern, the healthy diet recommendation of consuming 5 portions of vegetables and fruit combined was not met by 94% of the population. Healthy lifestyle advice, less than 25% adults received advice on healthy lifestyle from care providers. Blood glucose, the overall prevalence of impaired fasting glycemia was 3.4, while the prevalence of raised fasting blood glucose was 60%. Cholesterol among all participants, the level of high total cholesterol and or currently on medication was 13.6. Study implication, the findings of this survey have several policy and pragmatic implications for improving NCDs prevention and control. The following are recommended for reducing risk factors of chronic disease in Sudan: implement of the Framework Convention on Tobacco Control, beginning by banning smoking in the public places, review existing prevention and control programs for NCDs in Sudan, health services, and examine the feasibility of smoking cessation program implementation as a part of these services. Develop adequate referral mechanism for when risk factors for chronic disease are identified in the population. Build capacity of health care personnel to address NCDs prevention and control. Conduct further research on NCDs, their risk factors and impacts, such as for the harmful use of tobacco, health outcomes in general, and economic impact of the NCDs to further understand the true burden of the NCDs in Sudan. By the way, the population was aged from 18 to 69. Those are participants in this survey. Thank you.
بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد، بلاد ميلاد.